We're going to work on the intermediate tab now. The tabs at the top are similar to the comprehensive. You have all the tabs to the left that the staff use, and then you have your widescreen tabs that the doctor use. Let's look at the staff's tab, a 92002. And when you look at that tab, you will notice that the entire history, chief complaint, and the objective information is all put on the same tab. Some of the tests that we do not do for an intermediate have been removed down here. The medication, the refraction, the contact lens, anterior, posterior, and plan tab are all slightly different. I'm going to look at the widescreen tab for the doctors, which is next to the summary 92002. Now as you look at this 92002 tab, it is very similar to the comprehensive tab, but it is laid out a little bit differently. You still have your chief complaint on the left hand side. You have some area for additional notes, some basic information up here on the family history, patient history, if they're diabetic or not, that's still highlighted in red, pregnancy, you've got your medical alert, allergies, you've got the medicine that they've been taking and any ocular medicine that they've been taking. It is all put on this one tab, just arranged differently, and a few things are not there that were on the previous comprehensive tab. You can see the objective and RX tab look very similar, but again not exactly the same as a comprehensive tab. You still have your unaided acuity, your corrected acuity, pupils, visual field, pressures are up here, any additional testing, refraction is down here, and your contact lens section is here. When you compare the two, you will see that some of the testing is missing on this tab. The anterior and posterior tab is also slightly different. You still have your CD ratio and your pressures right here, but you can see a lot of the anterior and posterior segment information is no longer available to you. The assessment plan and medical decision making information on the right hand side here is the same. You also have a quick diagnosis tab. It is also the same as it was previously. When I go back to the summary tab, it is exactly the same as it is on a comprehensive exam. There is no difference on the summary. Let's look at a contact lens progress check. On a contact lens progress check, the tabs are very limited. You will not see widescreen tabs on a contact lens progress check. The reason you don't see a lot of tabs is there's not a lot to do. The patient is coming in just to have their contacts checked. So you have the summary, which is identical to the summary on comprehensive and intermediate. You have a contact lens check, contact lens eval. The refraction is the same. The anterior segment is the same. The plan is the same. So let's look at the contact lens check. What you see on a contact lens check is the history. Very brief information to put in here. Remember, hit tab or your data won't save down to the lower box down here. Whatever's in this box is what's printed on the record. You have the patient's aided acuity right here, and this says patient declines any problems with insertion removal, patient declines any discomfort during the day. This one says contact lens center well with adequate movement, cornea is clear, and conjunctiva is white in both eyes. So if a patient comes in and you ask how they're doing, say I'm doing fine with the contacts, you can type in here no problems, visual acuity is 20/20, and then I just check these off. Are you having any problems? No. I looked at the contacts, they center well. And then I looked at the eyes are fine. So I'm done. Over to the right is if you want to add any information about any pathology you see on the eyes. The next tab over is contact lens eval, and it is exactly like your contact lens tab. There's no difference here, so you can make notations there. Then on the plan tab, what I do is add Make a little note in the diagnosis, contact lens follow-up. I like to do it in caps so it's easier to see on the summary page. Good centration, movement, follow-up, 1 year. Save, sign off at the top. Rule, you didn't check the height, weight, or blood pressure. You didn't document that. Just click no. And it says you're missing some other information. Well, we understand that. We're just doing contact lens check. And that's the contact lens check.